So, hi everyone. I'm Major Sharon Sosparo, and thank you for joining us for this next discussion with the Marine Women's Initiative team. And today's discussion is about pelvic floor health. But before we get started, let's give this disclaimer. The views expressed here are those of the group and do not reflect the official policy or position of the Marine Corps, the Department of the Navy, Department of Defense, or the U.S. government. So tonight's guest I'm very excited to introduce is Regina Faison. Regina graduated from Howard University and has been actively practicing physical therapy for 30 years. She has been specializing in pelvic floor therapy for the last 16 years. And I have to tell you that I met her a couple of months ago when she became my physical therapist, and she's been working wonders as I'm recovering from a pretty severe abdominal surgery. And I had no idea the extent of the pelvic floor health and how much we need it as not only athletes, but just women doing normal day-to-day things. And then what she shocked me with a couple of weeks ago was how important it is for men. So Regina, I'm just going to turn this over to you because you know the drill. You've been doing this for over 16 years, and I'm just going to let you shock everyone with your knowledge here. Welcome. Oh, I'm going to unmute you. Regina, you have to hit mute. Yeah, there you go.
Okay. Thank you, and so much for inviting me. I am so excited to share with you all this information about the pelvic floor. The muscles that nobody talks about, that everybody uses every day, so much unconsciously that if you don't have any problems, you don't think about it. So let's just get started first with the anatomy, or what are the pelvic floor muscles and where are they located? The pelvic floor muscles are located in what we call the pelvic outlet. So at the bottom of our pelvis, at your from your tailbone to your pubic bone, they sit almost like a cradle. And so those are the muscles from the front to the back that are considered the pelvic floor muscles. So I have like a cross section that I can kind of show you. This is the pubic bone here in the front. This would be the pelvic floor muscles here, all the way up to the tailbone here in the back. Here is your bladder. There's your uterus. This is the vaginal canal. That's the rectum, okay? But not only females, but male side. Here we go again. The pubic bone here in the front. Here are the pelvic floor muscles all the way back up to the tailbone. There's the bladder and the rectum, okay? So in the pelvic floor muscles, we have a superficial layer and we have a deep layer. The superficial layer for most women sits right there underneath your labia. And the deeper layer, of course, goes from the pubic bone to the tailbone. In the men, the superficial layer is coming up the base of the penis. The pelvic floor muscle has three major functions. First, it supports your organs. So it keeps all your bladder, your rectum, your uterus, everything lifted up so it's not dropping down into your vaginal canal or just lower into your pelvic floor near your rectum for men. Second, it helps with the opening and closure of your urethra and your anus, so it controls bowel and bladder function. Third, it helps with sexual appreciation. Okay, so there are a few like common diagnoses that you may hear, see talked about. First one is pelvic floor dysfunction. It's kind of a catch-all for all kind of issues that may be going on. Ones that you may be more familiar with are incontinence, constipation, urinary retention, urinary frequency, sexual dysfunction, erectile dysfunction, prostatitis, vaginismus, dyspareunia are a few of the diagnoses that you may get. And you're like, okay, well, what is this? Now, there are a few diagnoses, and of course, pelvic pain. There are a few diagnoses that may require a little bit more explanation. Like you may get, well, you have vaginismus. Well, what is vaginismus? Vaginismus basically means that when you go to have intercourse or you go to have a gynecological exam, what happens is that your pelvic floor muscles tighten and close off and don't allow for any entrance. So that's the basis of what, vaginismus is. Dyspareunia is basically pain with sex. Incontinence is you're having issues controlling, it could be your urine or your bowel function, because you can have fecal incontinence as well. You may hear stress incontinence, urge incontinence. What's the difference? Stress incontinence is an incontinence that happens when there's stress placed upon the bladder. So whether you cough, sneeze, laugh, run, jump, that's a stress incontinence. If you have an incontinence like, oh, I've got to go to the bathroom, you start on your way to the bathroom and it's like coming down before you get there, generally that's an urge incontinence. Now with an urge incontinence, it's very big dietary impact. A lot of the times what happens is we consume bladder irritants. Bladder irritants can be anything from coffee and tea, which are like at the top of the list, to spicy food, milk, chocolate, all these things, caffeine, caffeinated beverages, carbonated beverages. Even carbonated water could be an irritant to the bladder, which can cause you to have problems when you're on your way and can't hold it. So there are dietary impacts also that are happening with the pelvic floor because the bladder and the pelvic floor work in conjunction with one another. So when the pelvic floor muscles are tight, the bladder is relaxing, enabling it to fill. When the bladder contracts, the pelvic floor muscles have to relax to allow the contents of the bladder to be emptied. Okay, so as they're working together, sometimes there's a disconnect, and hence people will end up with problems with retention, incontinence, frequency, because they may not be getting enough support, or they just have, you can also kind of teach your body not to have as much control, which is what a lot of us will do, right? It's like, oh, I'm having a problem, let me go to the bathroom more frequently. When you go to the bathroom more frequently, you then retrain your bladder to send you to the bathroom with less urine in it. So then you're like, oh, I'm going. Okay, now I feel like I don't need to go, but now I'm getting the urge. It's because you've trained your body to go. So there's lots of things kind of encompassed in the pelvic floor, what's happening. You know, we look at dietary changes, we look at muscle strength and endurance, and we look at behaviors. All of those impact the pelvic floor and what's going on and the function that we have, okay? Now there's a big issue when we talk about pelvic floor muscle support and control. And why did we have these issues? How do we end up with pelvic floor muscle dysfunction? Some women, it's just gonna be hereditary. It's like, oh, I remember my mom or my grandmother were having these problems. It could be that you are just kind of set up through your genetics not to be as strong in that area. So then you might have to work a little bit harder to help maintain your bladder function or just pelvic floor muscle strength and endurance. Now, let me say one thing about the pelvic floor. They are muscles, they can be trained. So it's not like, hopeless. We see those commercials about poise. Oh, she's a athlete. There's nothing stronger than her. Okay, then if there was nothing stronger than her, then why are we advertising poise?
Right.
Let's increase that muscle strength so you don't need poise, so you don't need the pins, so you know what your body's doing, when it's doing it, and how to manage it. Now with muscles, we have what we call slow twitch and quick twitch fibers. Slow twitch fibers kick in a little bit slower, but they stay going for a long period of time. They're endurance fibers. So let's say if you were running, you would be a long distance runner. That would be your endurance fibers. Quick twitch fibers would be more like a sprinter. They kick in really fast. They don't last really long. It's over quick. But we need both of them in the pelvic floor. 70% of the pelvic floor muscle fibers are endurance fibers. So it's really important that we work on those exercises that are going to challenge the endurance in the muscle and not just kick it in and it's gone. Now we do need those muscles fibers to kick in as well, because if you feel like, oh, I need to go to the bathroom and something's coming, you need to kick it in really quick to stop it, right? So you need to work both of those fibers so that we have better control, more endurance, so we can make it where we need to go. So that's really important. So as we talk about that, there are other things that can impact pelvic floor muscle dysfunction. One big thing that I think a lot of people don't think about is how we are brought up, how we're reared. If you're brought up in a very religious or very strict household, especially when we're talking about sexual activity, that can cause a problem with our pelvic floor muscle function. Because especially when you talk about, if you get married, you've waited till you've gotten married, you go to have intercourse, you can't. It's very painful. Your husband is unable to penetrate you, and you're like, what's the problem? What's going on? Some of it is definitely muscular. And there's another part that is hugely psychological. There's a huge psychological component when we talk about pelvic floor muscles and control, whether that's urinary function, sexual function. We have to consider all of these things. Okay, so you can end up with vaginismus with that baseline of coming from a really strict household. Sometimes you end up with pelvic floor muscle injuries from just injuries. You could slip and fall on the ice, hit your tailbone. You can fall down on a bicycle right there on the bar in the middle. Sometimes too much bicycle riding can actually cause problems because it's constantly pressing on that area. So a lot of weight training, a lot of heavy lifting, a lot of running. So sometimes those activities that you need to do as part of your job could be contributing to problems that you're having with your pelvic floor. Okay.
I think that probably, Regina, I think that probably resonated with so many Marines right now listening because, and I know you'll get into this, but like, what could we do to help fix that? Like you said, it's a muscle, we can train it. Yeah.
Yeah. Another big thing for women that impacts the pelvic floor is your childbirth experience. When you are having a baby, and definitely you have it vaginally, the baby has to push through, the muscles have to relax. And unfortunately now with a lot of people giving birth with epidurals, they don't feel what's happening. They're not in as much control of their pelvic floor muscles. And unfortunately, we end up with a lot of tears in the perineum, into the vaginal region, third and fourth degree tears, which are extremely painful, but they also will set you up for problems for incontinence issues, pain once you heal after, because you get stitched up, depending on how much they stitch you up, it may not be as flexible as it was prior to you having that baby. Excuse me, and even a second degree tear, depending on where it is, can cause problems. So after you have a baby, and a lot of people like, oh, you had a baby, it's normal. Oh, every time I cough, sneeze, laugh, oh, pick up the baby. Oh, I just pee a little. You don't have to. So just because it has been considered the norm, take this information today as knowing that it doesn't have to be the norm for you. Now, there are issues and concerns that where you may get to a point where you are better, but you still may have just a little bit. And sometimes you do end up with nerve injuries after childbirth, after other injuries. So it is possible that you may not be completely back to normal. But generally after an injury, nobody gets completely back to normal because there's always that kind of injury in the background that is just not the same muscle strength, soft tissue tension that it was before. When you heal from injuries and tears, the tissue that heals is less flexible. It's a little bit more rigid. So that area is always going to be a little bit more prone to re-injury. So we want to take care of that in creating a nice supple kind of area. We may need to do scar mobilization to desensitize the area to help with some of the pain that may come up with these issues, but it's all possible to work and get better. Okay, so other issues that you may have when we're talking about decreased pelvic floor muscle support or strength sexual dysfunction, sexual sensation during sexual activity. You're like, well, it doesn't feel like it used to. And that can come from lack of pelvic floor muscle strength. Now, and also lack of blood supply, which hits both male and female, right? Because if you don't have the blood supply that hits the penis and helps to maintain and keep it erect, you can have problems maintaining your erection. First getting your erection, then maintaining it, then seeing it through to ejaculation. Some women will lose their sensation. It's like, well, it doesn't feel the same because the muscles are either too tight, they're not getting enough circulation. But if you start to work those muscles, you can have a return in sensation, you can have a return in control. So it's entirely possible to improve as well. You can improve your lubrication because when you have more blood supply coming to the area, it will help you be more lubricated for activities. Because some women will, after childbirth, notice that they don't lubricate as well. It's not as tight. But one thing I will tell you, if you are breastfeeding, you'll need to wait until you completely finish breastfeeding to know what your baseline is at that point. Because as you are breastfeeding, you can still have problems with, oh, it's not quite as lubricated or it's not quite as tight because your hormone levels have not reached their normal because you are still kind of in this process of continuation, not of the pregnancy, but still the other side of you taking care of your baby, of, the baby latching on and, for lack of a better word, being a succubus. So now, because you are in that state, you are giving and giving and giving. So your body doesn't have it all to just replenish in itself. So once you get to the point where you've weaned the baby off, the baby stopped breastfeeding, everything has started to return. At that point in time, if you're still having problems and still having issues, then I definitely would say seek out some assistance. Some of it will just clear up on its own, but you don't have to wait. Even while you're in the process of breastfeeding, you can still come have therapy. And then as you finish, you can continue on your own and kind of see where you finally land. Okay. So one thing I do want to talk about when we're talking about pelvic floor and the impact, sometimes we're talking about strength and circulation and different things. Now, it could also be that the pelvic floor muscles are too tight. We don't talk about the issue of tight pelvic floor muscles. And there's a difference between them being toned and being tight. Toned muscles are firm, but they're flexible. Tight muscles don't give. We don't want tight muscles. We want toned muscles. We want them to be strong. We want them to be flexible. Tight muscles that do not give can cause all kinds of problems, from pain, like I said, urinary retention, constipation. You have to keep your bowels moving in order to minimize some of the problems that you're having in your pelvic floor. So if you remember, everything is kind of sitting here together. So if you have a bunch of stools sitting here, it can press forward, push on the bladder, take up space in the vaginal canal. So we want to keep that moving. And if the muscles are too tight, it doesn't open up. And then we can have problems with constipation. If you notice the stool, you should, take a look at what's in the toilet when you get finished. So you know what's normal, right? Stool that is kind of flat and kind of ribbon-like is an indication that the pelvic floor muscles are too tight. They're not opening up and allowing for you to get that nice kind of bulbous, kind of log-looking stool. And that's what you want, not thin ribbon-like, okay? So it's also very important, it's like looking in the toilet is important. The other thing that I will say is important is you have to look at your lady bits, okay? Everybody get out a mirror and look and see what's happening down there. Because if you don't know what's normal for yourself, it's hard to go and say, this is not right. You need to see what it looks like. what it feels like, also kind of like, what does it smell like? What are your normal smells? Because we go through during our cycle that we go through different changes in our body. And you want to know what's normal. You want to get comfortable with your body. So you feel like, okay, this is normal. Okay, this is not normal. Let me go see somebody about it. Or if you have a, spouse, significant other, and you have a good relationship where you can say, does this feel normal to you? Because it feels a little off, but I don't know. So, but I would encourage everybody to just get a mirror and start investigating, because the more comfortable you are with your body and the more you know about your body, the easier it is to make changes and for things to get better. Okay.
And we're going to remind everybody that they're on Zoom right now. So maybe not get the mirror right now. Yeah.
No, not at this moment. But the other thing, also want to talk about is we in our daily lives have a lot of stress. We're dealing with a lot of things. Stress is a huge impactor on the pelvic floor. If you think about, how people like carry a lot of stress in their neck, they're like around like this. You don't even know it because you've been doing it so long until somebody's like, oh, comes up and you're like, oh, that hurts. Or, you're like, oh, this is really hard. Nobody's going to walk up and touch your pelvic floor. So you have to be aware of what feels normal. A lot of people will say they start feeling more pain, more uncomfortable, less control when they're stressed. What's happening? We're holding stress in our pelvic floor muscles. And if you are unable to recognize that, oh, this is a stressful situation, these are the things that have started to happen, then you can start to notice when you're holding stress in your pelvic floor and the impact that it's having on you. That is a huge component, especially with a lot of men. We're talking about they have, prostatitis. A lot of times it's like they'll go to the urologist. It's like, oh, what's the problem? Oh, you have prostatitis. Take this medication and you'll be fine. Take medication. They're still having problems. They're still having frequency issues. They're still having urinary retention issues. And then they start noticing, oh, they're really wound up. And when they get really wound up, they can't go. And it's important to know that if we look at kind of, if you can see, this is the prostate here, and there's the bladder on top. Here are the pelvic floor muscles. So in men, we have this intermediate of the prostate in between the bladder and the pelvic floor muscles. So if the prostate is enlarged, whether just from as you age, it starts to enlarge, or from prostatitis, it can cause a lot of problems. And so we definitely want to be aware of what's happening in our body. Stress, if stress can kill you, it can definitely tighten pelvic floor muscles. So just keep that in mind, that when you're going through things and you're noticing tension in your body, know that it can also be impacting your pelvic floor, okay? Now, when we talk about, in particular, incontinence issues, especially when you're talking about athletes being physically active, being able to do your PT training and getting all these things in, it's like, well, I can't stop. I've got to get ready. I'm peeing myself, but I can't stop. Okay, it's completely understandable. Unfortunately, impact activities are horrible on the pelvic floor. So lifting, jumping, running, all those things that put all that impact will weaken the pelvic floor. So with that in mind, what we have to do is kind of balance, what do we need to do to increase the strength in the pelvic floor as much as we can minimize the impact from the activities that we need to do. Can you stop the running and jumping for like a week or two to just work on your pelvic floor muscle strength to get that better, so that you can gradually go back to the activities that you need to do? Sometimes it's not, it may be an all or none. And we want to make sure that before we get to the point where it's a must that we have to. If you're not having to do a lot of running and training and lifting, you want to take that point in time to really work on the pelvic floor muscles so that you can begin to strengthen them. The other thing I want to tell you about strengthening your pelvic floor muscles is you want to do it in isolation. A lot of people like, well, I've been doing these Kegels and it's not getting any better. And I would say, well, it could be that you may not actually be isolating the pelvic floor muscles. So what happens then is that your abdominal muscles will kick in, your glutes will kick in, your inner thighs will kick in, especially when the muscles are weak. Our body is a wonderful thing. And when we need to do an activity, if the muscles that do the activity are not strong enough, the rest of the body's like, hey, let's help out, which is great, but not for the pelvic floor muscles, because we don't want everybody kicking in, because what happens is when we need to control it, the pelvic floor muscles haven't strengthened enough to put the pressure on the urethra to keep everything up and in, right? So as much as we love the other muscles helping, in this instance, we want to really be able to isolate those pelvic floor muscles. Sometimes what you can do is, as you were urinating, trying to stop the urine flow and pay attention to what's happening vaginally and anally, you should feel your pelvic floor muscles in the center of your body, not in your glutes. So if you feel like you're squeezing your butt cheeks together, it's like, oh, I got it. That's wrong. You want to feel it in the center, okay? You should feel it vaginally and anally, because the pelvic floor muscles go back and they attach on the tailbone. So that means both of those areas are included. So as you're trying to contract those muscles, you should feel it in those areas. Now, you will also feel it in your lower abdominals, because the transverse abdominis also help with contraction in the pelvic floor. But what people will tend to do is hold their breath and they'll pull in their stomach, squeeze their butt. It's like, oh, I'm doing it. No, you're not. You're not really doing it. And then you're not getting better. And then you get frustrated and then you stop. And then it's like, well, I guess I'll just put that pad on. And then that kind of starts the cycle. But that does not have to be the end of it. You want to find somebody who can help you, or you can help yourself. One easy trick, if you are still menstruating, you can use like a tampon, just put it in right into the vaginal canal and see if you can kind of squeeze against it. And you should be able to feel your muscles contract against that. Now, if your muscles are really weak, then that might be too tiny. So if you have like a vibrator that you can kind of put in and squeeze against, that will give you kind of like the feedback that you need to say, oh, I'm in the right place. Okay. If you don't feel anything happening, then you may not be in the right place, or you could be in the right place and it's just that you don't have enough strength or endurance to feel it. So that once the muscle kicks in, it's so quick that it starts to release that you may not feel it. So, but if you're having that much of a problem, I would say definitely seek out a pelvic floor therapist who can help you isolate and begin to work on the endurance in the muscle. And sometimes as you're trying to strengthen those muscles, a lot of times what we do is we try to hold it too long. If you're having problems, they're like, oh, I'm going to hold this for 10 seconds. It's going to be great. And then you're like, oh, this is not getting any better, or it's getting worse. It's like, what happened is it's gotten worse and I'm doing these exercises. It's because you fatigue the muscle out. You've tired it because it's not able to hold for the amount of time that you're trying to hold it. And so now the muscle is tired. And it's like, now I can't do the work that I was doing before. And it feels like it's gotten much worse. So with that, you really want to try to find somebody to kind of help you, because the endurance in the muscle is hugely important. Because if you try to do it too long, it's going to you're just working in futility, because the muscles are just going to get tired and they're not going to be able to be helpful. And if you're not doing enough, you may see some change, but you may not be able to get as much change as you really need to feel more confident. And a lot of times, working on those pelvic floor muscles and just a little bit being consistent, because consistency is the key. Sometimes it doesn't take a whole lot to go from having little leaks to being completely continent, or feeling like, okay, well, I was able to feel that orgasm where before it was like there was nothing there. It was like, oh, it's coming back. Sometimes it doesn't take that much. It just takes consistency. And that's what I would encourage you. If you're going to start doing pelvic floor muscle exercises, you're going to have to be consistent, because once you stop, it goes backwards. It's just like weight training, any other weight training. You know, you're out there lifting weights, you're doing all these activities to get this, you know, to reach whatever goal or whatever level of health, to do whatever you need to do. But once you stop, it goes backwards. And it's the same thing with the pelvic floor muscles. We have to maintain. You really want to be able to find a way to incorporate it into your daily life that is not so much like, oh, let me go do these Kegels, or maybe it is, depending on what your personality is, right? If you can incorporate it in your regular exercise program, but only once you're able to isolate the muscle. Because what happens at a lot of times, especially with Pilates, because there's a lot of engagement in the core, people are like, well, you know, I go to Pilates, I'm doing this, you know, I shouldn't have any problems. And that's great. Unfortunately, what happens is that you're engaging the core and the pelvic floor muscles so much that the core overpowers the pelvic floor muscles, and then you're not getting the best isolation and compression. So I would encourage you to engage abdominal muscles only after you've gotten to the point where you know the difference between a pelvic floor muscle contraction and an abdominal contraction. You can differentiate the difference and you can isolate them both, because that's going to give you the best kind of quality, strength, and then change in the improvement in the pelvic floor muscles and your quality of life. Because at the end of the day, it's a quality of life issue, whether it's controlling your urinary and bowel function, whether it's being able to engage and enjoy sexual activity. It's a quality of life issue, and it impacts you. And so we want to be able to be whole, because if you think about it, pelvic floor muscles are at the center of your body. They are also considered your second diaphragm. So it's like they are so integral in everything that we do that we want to take care of them. We want to have good pelvic floor muscle health. And unfortunately, people wait until we're having problems till you start looking at what can I do. What I want to encourage you is don't wait till you start having problems to start working on your pelvic floor. It's like, look, check it out. You know, can you feel them? What, you know, whether you want to look or you want to feel while you're having sexual activity, you know, can you squeeze? Because that's what a lot of people will identify it with, right? Can you squeeze? You know, can you feel that? And that may be your, you know, your barometer. Whatever helps you, I encourage you to do whatever helps you that you're comfortable with. But you want to start incorporating your pelvic floor into your activities, especially if we're talking about, you know, having children. It's extremely important to know what the muscles feel like when they're contracting, when they're relaxing, when you are trying to push out a baby, because you need to be able to relax the muscles in order to allow the descent of the baby into the birth canal and then out of the body. So they're extremely important in a lot of activities, even just bowel function. The pelvic floor muscles actually help to bring some of the bowel down into the rectum so it can come out of the body. So it's not just about sexual function, which is what most people kind of think, oh, pelvic floor muscles, sexual function. The main goal of the pelvic floor muscles is to be supportive and to control bowel and bladder function. And so that's what we want to look at and look forward to, and we want to take care of. Because when we have good pelvic floor muscle health, then our body is better aligned. All right. Posture is also really huge when we talk about pelvic floor, as well as having abdominal surgeries. Abdominal surgeries, as you heal, there can cause a lot of tightness along the scar, which can pull. And that pulling down at the pelvic region can impact the pelvic floor because we have what we call connective tissue. So our muscles are surrounded by tissues that are weave kind of in and out. We have tendons and that kind of come down, and we have what we call aponeuroses, areas that kind of come together and kind of meet. Everybody is connecting, right? It's like a network. So if I cut through my network and then my network starts to heal, it's going to impact what's flowing in the rest of my network. So because we have that impact and that kind of flows down, we want to be cognizant and aware that, okay, this abdominal surgery can impact my pelvic floor muscles. Back surgery can impact my pelvic floor muscles. If you have a back injury, it can impact your pelvic floor muscles. Also, leg muscles, if they're too tight, your adductors, or which are your inner thighs, come right in and attach up into the pelvic floor muscles. So if they're too tight, they're pulling, which can impact what's happening. So it's hugely important to maintain good flexibility from your abdominals, your back, your legs, so that their pelvic floor muscles stay in balance. And that's really what we want, is balanced pelvic floor muscles so that they can function, so that we don't have any problems with our urinary and bowel control, so that everything is supported. We don't have prolapse, because I know people, I didn't mention that earlier, but sometimes they're like, oh, you have a little prolapse. What is prolapse? And prolapse basically means that you had a drop, whether it's your bladder, your uterus, your rectum, that has dropped down into your vaginal canal, generally because you don't have a good pelvic floor muscle strength to hold everything up. So after you have children, after you have surgeries, straining too much when you have to go to the bathroom to have a bowel movement can cause you to have not only hemorrhoids, but can have prolapse, rectal prolapse. So you can end up with a rectocele. Now, there are different things you can do to improve that. You start basically with increasing your pelvic floor muscle strength. But there are, of course, then there's surgical repair, depending on how severe it is. But there's also, if you're not prone to surgery, you can also try pessaries, which can help with support and also control. So there are options, surgical, non-surgical, that can help. And just baseline, improving strength and endurance is our first kind of line of defense.
That was, like I said, you're going to blow everyone's mind with all of this. I'm wondering too, so oftentimes, or at least my misconception before I started talking to you was that pelvic floor therapy is really just for those women who have just had babies, which you've just completely debunked, that it's for everyone, men and women, and it's for all stages of life. But I'm wondering is there maybe specific things that you would do to help train pelvic floor for women who are about to give birth? Maybe they're still pregnant.
Yeah, I actually do have quite a few pregnant women. So we do pelvic floor therapy for women who are having issues like pain and imbalances in their pelvic floor. Because, as you're pregnant, everything is all loose and it's moving. So, which can create a lot of pain and discomfort. So we do pelvic floor therapy to help kind of balance everything out to make you more comfortable until you deliver. And also in that, we work on training to get you ready to recognize how to control your pelvic floor muscles. Because like I said, if you're going to push out that baby, you want to know what things feel like down there. It's like, okay, a lot of women will say, I don't know what I'm supposed to be doing. What does it feel like? But if you know what happens in your pelvic floor muscles when you contract them, what does that feel like? When you relax them, what does that feel like? Because when you are going to have a baby, you need to relax the pelvic floor muscles and gently bear down so that you can push that baby down through the vaginal canal. And so working on pelvic floor muscle strength will help in your pregnancy to first recognize what the pelvic floor muscles are doing, being able to control them so they can help you with your delivery. So that's important. Also, we do talk about perineal massage, because the more flexible you are in your perineum, when you go to push the baby out, then you're less likely to tear. And as I talked about before, if the pelvic floor muscles are too tight and everything's, circulation is not moving well, things aren't as moist and they're not as flexible. So that can impact your birthing experience as well. So we do physical therapy to help with just kind of recognizing what's happening. What do you need to do? What does this feel like? So that when you are going through birthing your baby, you are more aware. And then you can be in better control and not feel like, things were just happening and you had no idea what your body was doing or what it felt like. But at least with that training, you're like, okay, I feel this. And it also just kind of helps you know different parts of your body. Because when you are contracting your pelvic floor muscles, it helps you become aware of, okay, well, that's where the pelvic floor muscles are. And if they're saying, well, push here, like you're pushing, it's like, that's not where I need to be. So it helps you to recognize better your own anatomy, so that you're more aware of what's happening and you can better control what's going on.
Thank you. Thanks for that. Because one of the things that we've been advocating for is more pelvic floor therapists in the military, because oftentimes there's just not enough to go around for all of the women that are serving. And then this almost sounds too like a preventative measure on that front end. So if there's a way to, like, I don't want to say prevent an injury, but we oftentimes think about that kind of thing. If there's a way to help build up that strength and get a Marine, get a female service member to really recognize that before they give birth, perhaps there's a much easier transition, even if it's just a little bit, but if it's just a better recovery on that back end, it means that they can get back into the fight faster.
Oh, definitely. Yeah. Because if you at least know what the pelvic floor muscles, what needs to happen, because after you go through delivering a baby, it's going to be a little weak. You put a lot of strain on it. And so what happens is that after you recover, within the first week or so, you can then start to work on your pelvic floor muscles again. You can start to encourage better healing because you know where you are and what you're doing. And like I said, that is, the center of your body. That's going to help support you as you're recovering with all of the lifting, moving, and that you have to do now that you've had this baby.
I want to see if there are any questions. Okay, Carrie, looks like you got one.
All right. So from what I picked up, and please correct me if I'm wrong. So the things that we can do at home are to do the Kegel exercises if we know exactly how to do them, but also to just practice, like, while we're peeing, to stop midstream and continue to like be mindful of what muscles are being activated at that point. Is that correct?
It is correct in a sense, in that you want to stop the urine to be able to identify the muscle, but not consistently stop and start and stop and start. Because then your body's like, okay, are we going? Are we not going? It's like, what is she doing? And so you don't want to give it the wrong signals, but you can do it to identify where the muscles are so that you can better perform the Kegel, because you know what you're doing, or you at least can be able to identify and then reproduce that contraction when you're not urinating.
Okay, so I guess the question on the other side is, that's for women. So what can men do in order to kind of have that first assessment as well? Would they be able to do the same thing, or are there other things that they can do?
No, for men, it's the same thing, because it does the same function. So if they can stop the urine. Now with men, what you want to look for is you want to feel anally and under the scrotum should be where you feel the muscle contracting. Now, another thing for men is that they can practice just kind of lifting their penis up, and that will contract the pelvic floor muscles, but not like take your hand and lift it. That's, but you know how it's like, oh, let me see if I can lift it. Can I raise it up towards the ceiling? You know, like they used to do when they were boys. So that is another way to kind of identify the pelvic floor muscles in men. And with the mirror, we go with the mirror again, you can look as you try to lift up and see, do you see the movement of the testicles and the penis moving? Now, when you contract your pelvic floor muscles, what happens is the muscles tighten and then they lift into the body. So you should be able to feel a contraction and a lift. If your muscles are really weak, sometimes you won't feel the lift, but you want to definitely be able to feel that it's coming in. Did it come in? Did it lift up? And the same thing for both men and women. You can also, for women, use a mirror, and as you contract, you should see it pull in vaginally. You should see it moving. You definitely should be able to identify what's happening just by looking at it, but also what you want to be able to do is feel it. Because when you are doing your pelvic floor muscles, nobody should be able to tell that you're contracting them because they're all internal. Now, if somebody sees you up and down, it's like, what is she doing? Then that means you're using too many glutes because I shouldn't know what you're doing. We should all be able to sit here and contract pelvic floor muscles, hold the conversation, and nobody be any wiser as to what's happening. Okay, so if you feel yourself like up and down, or you're like, oh, when I got finished, oh, I feel like I did an ab workout, then you're using too many abs. If you feel like, oh, my butt is hurting or my inner thighs, then that means you've used them too much. Contracting the pelvic floor muscles, it's a small movement. So you want to be in tune to your body. So as you contract, you should feel either anally for both men and women, vaginally and anally for women, and anally and under the testicle, the scrotum for men is where you should feel it. Center of the body, very center. Okay.
Regina, do you have any recommendations for, do you have any recommendations for anything to assist somebody at home? So like in the same way that I imagine, like we buy weights or kettlebells so that we can do a workout at home. Is there anything that can assist someone, especially because athletes, I feel like, as you mentioned earlier, we're constantly doing a lot of pounding. We do a lot of running in the Marine Corps. We do a lot of, weightlifting and things like that. So it sounds as if just from those normal day-to-day things that we're doing, it's almost weakening our pelvic muscles, our pelvic floor muscles, if we're not focusing on those. So is there anything that you can recommend there?
Oh, definitely. There's lots of things you can do. There are things that are available. There are vaginal weights. There's like there used to be only like a couple. Now everybody's like in the game. Let's get some vaginal weights. So vaginal weights come in, I wish I had brought them. I didn't think about it. They are like either like little balls or they're like little cones. I particularly prefer the ones that are balls, and some of them have a little ball inside of the ball. So when you're moving, because when you're using vaginal weights, you need to be upright, not laying down or sitting, because once you get up with the pelvic floor muscles, the weight kind of hits the pelvic floor muscles. And what happens is your pelvic floor muscles automatically contract to hold the weight up and in. And you want to do that about 20 minutes a day, minimum. And so what I generally encourage people to do, especially if they're not really good about maintaining or being consistent with exercise, you can, if your routine is to get up, wash your face, brush your teeth, hop in the shower, get yourself together, that's about 20 minutes. If what you do first, after you urinate, put the weight in, you're up, you're moving around, you're doing your thing, you've gotten some pelvic floor muscle strengthening for the day. You can do weights. There's electrical stimulation that you can do to the pelvic floor muscles to kind of help they've come out with new like biofeedback that you can purchase, that a part of it goes in vaginally that you can kind of squeeze against. And they have apps that you can use that actually gives you the feedback as to how much you're squeezing it. Was that in the right place? You can utilize those if you don't have anybody to put you on the right path. Besides the weights and the e-stem and the trainers, they still have a lot of apps to kind of help keep you, like, do your exercises, be consistent. Those have been really helpful for people, because then you don't have to worry about how many contractions did I just do, how long did I hold it, because pelvic floor muscles are very temperamental, and when you are contracting them, like I said, endurance is huge. So you want to be able to, first, when you're starting, whether that's with weights or just doing your exercises, you want to do just enough that gives you a little bit of a challenge, but not so much that you can't do it. So it's finding that balance, like with the weight. You put in the weight, okay, does it sit there? Can you feel it? If you get up and move it around, does it drop out? Or does it give you enough kind of awareness that I'm here and it's a little bit of a challenge, but not, oh, I don't really feel that. So you want to be able to feel it, give you some challenge, but not just you take 2 steps and it drops out. That one's too heavy. You can do, like I said, with the apps that will keep track of the number of seconds that you're holding. You have to kind of be aware of when you feel the muscle contract and when it relaxes. If you try to do that about 10 times, it's like, how many seconds are you actually able to hold consistently? Because a lot of us can't get to 10 seconds because we're not working on it. So if you are only able to hold 2 seconds, then fine. Start with a 2-second hold, 10-second relax. You definitely want to give yourself time to relax the muscle, because it needs to recover. If you're just constantly doing it, then you fatigue out the muscle and you're like, I don't know what's wrong. This isn't getting any better. You have to really train the muscles. You have to contract it, relax it, contract it, relax it, and then build a good foundation, and then start adding on top of that, whether that's going to be with just Kegels or the weights. They do also have a vaginal barbell. So there are different helps, for you if it's not straight, oh, let me just focus on these exercises, because, a lot of us don't want to be adding another activity to our already busy lives. So if you are not having any problems at all, I would encourage you, just go buy you a set of weights. It's the easiest thing to do. Pop it in, go along with your day. You can keep on cooking dinner, taking care of the kids, whatever you need to do. Nobody knows that you're working on your pelvic floor. And then as you get better with it, you can challenge yourself. You can add exercises. You can start doing squats and lunges and different things as you have the weights in, or, vacuuming, because that vacuuming and moving around with the weights in takes a little bit of, strength. So just doing activities like that can begin to help to strengthen. Now, for men, they don't have as many options. I've seen very few weights for men. And of course, that's not as comfortable, because, it's anal, it's hanging out, it's not going to be quite as comfortable, but it's usually pretty easy to kind of work those muscles. For men, it's just the awareness of being able to know where the muscle is. So one of the biggest takeaways is being able to identify the pelvic floor muscles, because that's huge. Because if you can't identify the muscle and you're doing all these exercises, then it could just be that you're exercising in futility. And that's not what we want. Well, because it can be very discouraging. So I would definitely encourage you to know your body be able to feel it. Sometimes what you need to do is close your eyes. When you take the vision out of the activity, you can feel your body better. So when you're trying to tighten your pelvic floor muscles, you might need to just close your eyes and it's like, what do I feel? Where is that? And so the more you can identify with the muscles, where they are, and then being in control of them, then it's very much, you can get to the point where you have better control. You don't have to worry about having leaks. You don't have to worry about having issues with sexual activity. It's just across the board, just kind of better health, because it helps with your posture, your breathing. The pelvic floor muscles are just hugely important. So we definitely want to be able to first identify them, isolate them, strengthen them, and maintain them.
How about anyone, so say for example, a Marine is, the last time that they had a child was say 5 years ago or more, and they've never really received care. They've never even taken care of their pelvic floor. I mean, all hope is not lost, correct? They can start anyway. Okay.
All hope is not lost because they're muscles. And so anytime you start weight training, especially when you are in the right muscle and you are given the right stimulus, then you can build them up. Unless you have like some muscle disorder, then we might have some issues. But if it's just been like, oh, they've just been this way since I had my baby and I haven't really done anything about it, it doesn't mean that you have to stay in that place. You can get better. Things can improve. We don't have to run and leak and jump and leak and dance and leak. We can, get to a point where that's minimized. Hopefully we can get to, the earlier you address it, the easier it is to get back to baseline where you're not having any problems. But if you at some point start to address it, it can get better.
Do you have any recommendations? So, I think that this is providing, so thank you so much. You've provided a lot of context for women and men who might have just thought, oh, well, what I was experiencing was normal. I thought it was just part of getting older or having a baby or whatever it is. So they can go and ask their doctor for a referral. Is there, I don't know if there's like something where that you've seen more success where people have asked their doctor because of a certain issue getting care. I don't know if there's a differentiator.
No,
okay.
I think that most important thing is to recognize that this is where the problem is coming from. And if you've gone, a lot of times by the time people end up at pelvic floor therapists, they've gone through doctor after doctor after doctor. This is an issue. I'm having these problems. And, unfortunately, women have been told, oh, it's just in your head. No, it's not in my head. It's happening. And at that point, you want to find a different provider, if at all possible. And then you have to sometimes be your own advocate and say, look, I would like to try this. Because a lot of times they'll just like, oh, here's some medication. If you're going too frequently or you're having some leaks, oh, here, take this medicine, that should help. Fine, but can I also go see a physical therapist that can also help me so that this doesn't become an ongoing problem? Because everybody doesn't want to take medication forever and ever. Or, it might be that, I really do want to have another baby, but I'm, afraid that this is just going to make matters worse. What can I do to get it better before I embark on that venture again? And that is entirely up to you to stand up for yourself and say, this is what I need. But first is the awareness of knowing that this could be what the issue is. And as a physical therapist who does this all day, I have no problem with somebody coming and like, I'm not really sure if I need your help. I don't know if this is a problem, but these are some of the issues that I have not been able to resolve. And then we look at that. We can assess that. And if I feel like, this is coming from somewhere else, or I don't think this is a problem, then at least you can cross that off, right? Sometimes I think all of us kind of have a little issue with our pelvic floor after certain, if you're aging, if you haven't been sexually active for a while, being sexually active is hugely important for your pelvic floor. It's like an exercise, right? It helps to bring circulation, it helps to work the muscles. So it's important. And a lot of times we'll get in the habit of not really being sexually active, or we don't have anybody, or it's been a while. Or maybe there was issues before, and that's not what I really want to try to do again. So before you embark on that, you can go find somebody to work on that with you so that you can feel more comfortable, you can be more confident, whether that's with sexual activity, whether it's with urinary bowel control, pain. You just want to feel better. Because when the center of you does not feel good, you don't feel good.
Yeah, great point. Great point. I want to open it up to any questions from those on. We had a couple of people that dropped off, but they said, thank you so much. Great presentation, very informative. Any questions?
I know it's a lot of information.
No, it's good though, because this is probably the first time that so many of us have heard it. I mean, I remember when I first just did my intake with you, and I was like blown away. I mean, I'm like, I didn't know this affected all of this stuff. Yeah. Any questions from the crowd before we sign off? Okay, Regina, is there anything else that we might have missed that you think would be important for the crowd?
I would say that if there has been any trauma in that area, that you definitely, in conjunction with seeking a pelvic floor therapist, seek to find somebody to help you work through that, because our body does hold on to traumatic experiences, whether it's something that happened while you were engaging in battle, something that happened just kind of in your own private life. Our body holds it all, and a lot of it tends to be held in the pelvic floor, especially if that was an area where the attack happened. Or even I've had a lot of women who've had miscarriages, who have had problems with their pelvic floor. And we just hold all that, because what happens is that we expect our bodies to be able to do certain things. And then when they're not doing what we expect it to do, then we hold it, but not necessarily consciously aware of it. So what I would say, if there's been any trauma, whether it's miscarriage, any sexual assault, any traumatic experiences in warfare, that you find somebody to talk to first. Find a pelvic floor therapist, because as you're going through pelvic floor therapy, sometimes when you have that background, it can bring things up. Then you want somebody who's going to walk you through that. So at the other end of that, we have wholeness. And that's what we're looking for, is to be whole, right? And unfortunately, our body holds on to some things that we forget in our mind, but our body holds on to it. So even if you've had issues, because some people have had issues when they were children, with wetting the bed and different things, or I couldn't control it until I was this age, and then it went away and now it's back. Sometimes we're predisposed to things. And so we hold on to a lot kind of in our body. And when we have other experiences, it can bring it back. And so I would just encourage you to definitely take care of your body, find somebody who can help kind of emotionally bring you through it, because our emotions are in our gut, which sits right on top of our pelvic floor. And actually our pelvic floor holds part of that. So if there's a lot of emotional things, that's what I didn't mean to say. Our emotions can impact our bowel and bladder function, and whether or not, things are tight or not tight. So if you're emotional about things, and hormones are another thing that will impact you, because some women will say, you know what, right before my cycle or during my cycle, I don't feel like I have as much control, because the hormones are impacting your pelvic floor. So just, love yourself, be aware of what's happening in your body, and know that traumatic experiences can still be in our body, even though we've kind of moved past it in our mind. So if you do seek help for the physical, get emotional and psychological support as well.
Yeah, great point. Thank you so much for that, because there are an awful lot of men and women that have sexual trauma in their backgrounds, especially in the military. So thank you. And obviously to post-traumatic stress from combat situations as well. Thank you, Regina. Thank you so much for your time. This was so informative. I know that everyone that will be listening to the podcast later on, this is going to blow their minds. So thank you so much for your time and for being such a great professional and really having such a great passion for this topic as it comes across. So thank you so much.
Oh, you're welcome. Anytime.
Thanks. All right, bye.